Hi, I'm Elizabeth Kvale. I direct the Supportive Care and Survivorship Clinic at the University of Alabama at Birmingham. Survivorship care plans are a tool that we can use to help cancer survivors be in charge of their health in survivorship. Come with me while I see a patient and we learn about survivorship care planning. Hi, Chanel.
Hi, Dr. Kvale. How are you?
Good to see you.
Good
How are you?
I'm doing good.
I'm so glad to hear that.
I'm really excited. I just finished my last treatment for cancer. And even though this is really exciting, I'm a little, nervous about what to do now, what the next steps are.
Yeah, well, congratulations on getting through that journey. I know that's quite the odyssey. Mm-hmm. Yeah. So thinking about going forward, you'll probably need to continue to see your oncologist every 3 to 6 months for the next little while. So, but I bet that feels different to you than seeing them every week or every day when you're getting radiation.
Right.
Yeah. Does that make you nervous?
No, I'm just kind of wondering what I need to do.
Yeah.
What kind of plans to follow or...
Well, I think that's a really common issue as people finish cancer treatment, and it is a great time to begin thinking about your survivorship care plan.
What exactly is a survivorship care plan?
Well, a survivorship care plan is a plan that we can put together that will answer those questions for you and help you feel less uncertain about what your next steps are. One of the things that happens when people finish cancer treatment is when you're in treatment, you know exactly what you need to be doing to fight the cancer because somebody tells you when to go to treatment and what the medicines are doing for you. But when you finish treatment, that kind of goes away and then you're in charge.
Right.
So a survivorship care plan just kind of helps line that up for you so that you know what you're in charge of.
So what goes in a care plan?
Well, there are some important components of a care plan that we think should be in there. And those are things like listing the treatments you've got, because it's not easy to remember that. Cancer treatments are complex, but it may be important for your primary care physician or for other doctors to know which treatments you got and how they were delivered. So one of the things that we'll do is just kind of make a record of what your cancer was and how it was treated. And then you'll have that anytime you need it. And then moving from that, we'll put things in there like thinking about what things you should be watching for with your health. And that might include things that are like the late effects of your cancer treatment. So some of the things that are fairly normal side effects of your treatment, even as you're moving into survivorship. We'll think about those and which ones of those you should take to your doctors and which ones of those you kind of live with for a period of time. And then other red flags, things that might make you want to come back to the doctor sooner than you normally would on your regular surveillance schedule. We'll put those in your survivorship care plan. And then we'll think about just the sorts of things that you need to be managing to manage your health, your other health issues, your hypertension, other things like that we might need to put in there so that you're thinking about your health as a big picture.
Okay, so what kind of things can I do to improve my health?
Well, there are all sorts of things that you can do to improve your health. Are you a smoker?
No.
I'm so glad to hear that because not smoking is one of the biggest things that you can do to ensure that you remain healthy in survivorship. Another thing to think about are the sorts of health behaviors that it might be good for you to adopt as you move into survivorship. Sometimes completing cancer treatment is a time that people can think about how they want to be moving forward and how they want to optimize their health. And so there are some things that we know are good for almost everybody. An example of that would be exercise. There's almost nobody that wouldn't benefit from exercise.
Okay.
Another area that people often identify that they would like to make health improvements is with their diet. Oftentimes moving into survivorship is a time that people look at their diet and think, I think I could do better than that.
Right.
Have you been thinking about any of those things?
I have been wondering about my diet, and I have to admit I don't exercise as much as I should.
Well, good. One of the things that we find is most powerful is to put you in charge of your survivorship care plan and to put you in charge of what your healthcare priorities are moving forward. So it's most important that we think together about what's important for you from a cancer surveillance perspective, but also it's very important that you think about what's important to you with your health moving forward. And together we can work to put together a survivorship care plan that will work for you.
Okay, great. Well, some of this stuff sounds like I could talk to my primary care doctor about, but what kind of things do I need to let my oncologist know? What kind of things should I report? Aches and pains, like how would I know that my cancer came back?
Yeah, so one of the important things that you already recognize is that you are the element that moves between your oncologist and your primary care doctor. We would think that our doctors talk to each other, but that doesn't always happen. And so you are the person who's in charge of communication. So one of the things that you've already said is really important is that some of these health issues belong with your primary care doctor, and some of these health issues belong with your oncologist, but they both need to be aware of what's going on with your whole health picture, and you're the person who can do that. That's another reason to have a survivorship care plan, because that creates a document where all of these health issues are contained, and you can share that with all of your physicians.
Okay, great. Well, how do I get started on this care plan?
Well, we can sit down, and the first thing to do is to think about your history and put that together and put that down on paper, and we'll create it together.
Okay, sounds great.
Okay.
Thank you.
Patients have an active role in their cancer survivorship care planning. A survivorship care plan is a tool that can help you take charge of your health and survivorship. Your treatment team can help you make a survivorship care plan. To find examples of a survivorship care plan, you can go to livestrong.org or cdc.gov.